Alrighty guys, welcome back to another American Reacts. We're looking at a big one today, Australian healthcare. And chances are, 99% chance it's going to be better than American healthcare. I think that's no secret. This is from Healthcare Triage. And yeah, let's go straight to it. I'm an American. A lot of great things about America, but healthcare is one of our weak points. It's very expensive and controversial in many ways. It can be very good at times, but it can also be bad, and either way, it's expensive. And yeah, I'm anxious to learn about this. Let's see.
It's been a while since we've done an international healthcare system episode. We thought you might need a break. That break ends now. Australia has the only continental universal healthcare system, and it's the topic of this week's Healthcare Triage.
Wow, interesting. Without knowing too much about it, I've had a lot of viewers on this channel comment about it and boast about it. I've heard a lot of good things about Australian healthcare, so let's see what it's like. It's got to be
Pretty
better
much
than
every
what I'm
other
used to.
country we've covered, save the United States, Australia has a universal healthcare system. It's called Medicare. What is the deal with that? Seriously, do none of these countries have a thesaurus or something? Medicare, Medicare, Medicare. Anyway, Australia's national public system provides coverage for citizens, permanent residents, and even many people with temporary visas. There's a program for visiting students, and even people seeking asylum get coverage while their cases are under review. Australia also
really
has a
neat.
voluntary
Very
private
inclusive.
health insurance system, which complements and supplements the public one. It can give citizens access to private hospitals and some services not covered by the public system. The tax system incentivizes the purchase of private insurance for many individuals and families. Medicare.
So there you go. It starts out where it's inclusive for everyone. That's a good sign, right? And also, it still has flexibility. It sounds like if you want a private route, you can go that way as well. Already starting out pretty good.
Also allows people to get free inpatient care in public hospitals, free access to most medical services, and prescription drugs. The federal government also works with more local governments to provide population health, mental health, some dental care, some physical therapy, and services for veterans. Medicare pays for somewhere between
impressive.
85% and 100% of outpatient services. It also pays for 75% of the medical fee schedule for private patients who use public hospitals. Whatever isn't covered must be paid for by patients. Doctors can charge whatever they want, although in
Dang, if you guys knew, I mean, maybe you guys do, how expensive all the things he's been listing is here in America. It's unbelievable. The coverage, if you don't have it covered by your job, a lot of jobs don't. There are some jobs that are very valuable just because they cover healthcare, but most jobs don't. It's very expensive for coverage, very expensive for medicine, prescriptions. You go to the hospital, whatever you're there for is obviously a bad day if you have to go to the ER, but it's even worse when you get out and then you get the bill. I mean, it's scary for some people, for most people. So it's, ugh.
Incentives are in place to make bulk billing more likely for the elderly, poor people, children, and people who live in rural areas. Members of those groups also get a discount on drugs. Their co-pays on prescriptions are around $5.90 Australian versus $36.10 for everyone else. There are out-of-pocket maximums. When an Australian is paid out $421.70, then Medicare covers 100% of the fee scheduled for doctors for the rest of the year. When they reach $1,221.90, then 80% of all out-of-pocket costs are covered for the rest of the year.
Yo, hearing this is like... This just is like a foreign language to me as an American, man. That is incredible.
For people in the special groups I mentioned before, the threshold is lowered to $610.70. Yes, that's complicated. Thanks, Australia. There are also ways for families.
You know, like, those are just such low numbers even. You know, you go to the ER, it depends on where you're at and what hospital and stuff, but I mean, it is not uncommon to get hurt, go to the ER, get checked out, get sent home, and get a $5,000 bill or much more. I mean, surgeries, all these different things are just unbelievably astronomically expensive here in the U.S. So it's quite scary. And yeah, to hear what other countries, especially Australia, can get, wow.
Families to pool such spending and to hit the limits faster. There are pharmaceutical subsidies for those who reach a threshold of $1,391 in a calendar year too for drugs. The threshold is also lower for those in the special groups at $354. Australia is one of the cheaper healthcare systems. At 8.9% of GDP, Medicare is paid for mostly from general taxes, patient fees, and a 1.5% levy on taxable income. In 2010 to 11, the government funded about 69% of spending, 43% at the federal level, and 26% from states and territories. The rest, or about 31% of healthcare spending, comes from non-government sources. About 18% is out-of-pocket spending, in co-pays or services not covered by insurance.
Right.
Private health insurance accounted for about 8% of spending. About half of people have private insurance, which allows them more options in practitioners, hospitals, and care that they.
So that's an interesting stat there. That's more than I would have thought, really based on nothing more than a guess. But yeah, about half have private healthcare. Very interesting. I would have guessed around 25%. So that's
receive.
pretty
Those who
interesting.
opt for private insurance before their 31st birthday get a reduction in premiums for the rest of their lives.
Wow.
Each year, an Australian waits to start buying private insurance after they're 30, sees their rates go up 2% from a base rate, again, for as long as they live. Subsidies have been available to many Australians based on income since 1999. Most primary care doctors are self-employed and work in groups. About 8% of them are under contract with private agencies. Most work in a fee-for-service system. Most also get incentive payments for meeting standards set by the Royal Australian College of General Practitioners. In other words, they have a pay-for-performance system to try to improve quality. I know you watched that video, right? Patients can see any general practitioner they like. GPs do, however, need to refer them to specialists.
Oh, I don't know why it does that. So my initial thought hearing that is a good one, that basically it also gives a doctor incentive to do well, right? You get paid for better performance. That is kind of a relief, right? You want to go to the doctor and hope that they know what they're doing and can help you. So
Specialists also work on a fee-for-service basis, and many of them work in both the public and private parts of the system. After-hours care is available either from primary care docs themselves or from private companies set up among various practices. Grants are available from the government to run after-hours care. Hospitals come in all flavors. In 2011, about 55% were public, 23% were private day hospitals, and 21% were other types of private hospitals. Private hospitals come both in non-profit and for-profit types. Docs that work in public hospitals are usually salaried, although they can work in other reimbursement settings when seeing private patients. Long-term care is mostly provided by families, with some people getting subsidies to help with the expenses. Some homes or care centers are available for those who are very dependent on assistance. Support is both means-tested and dependence-tested. The majority of long-term care facilities are non-profit. About a third are private, for-profit, and about 10% are run by the government. Quality is generally measured and reported on by the Australian Commission on Safety and Quality in Healthcare. About 85% of general practices are accredited against standards, and as I mentioned before, pay-for-performance systems are in place to encourage better care.
That's awesome.
Some healthcare organizations and professional boards also have quality improvement programs. All citizens and permanent residents can get a personally controlled electronic health record if they want it. A fairly large amount of infrastructure exists to make such records interoperable at many facilities across the continent. Costs are controlled in a number of ways. The market uses generic drugs to keep pharmaceutical spending down.
Yeah.
Almost all brand name drugs are bulk purchased by the government, which can also control pricing. New drugs have to prove their cost effectiveness before they're bought. Public spending is under global budgets, but as with some other countries, this can lead to increased wait times for elective things. There are also broadly negotiated fees for many services. The knocks against the system will be familiar to those of you who are familiar with the series. Australia is worried about a shortage of professionals, but who isn't? In terms of quality, Australia sometimes comes behind some other countries we've discussed, but certainly beats others, like the US. The private overlay makes some people there concerned about a two-tiered system of care. It's interesting, though, that only about half of people opt for private insurance. Australia also has a disparities problem, with many Indigenous populations having lower quality outcomes and poorer health than other citizens. But life expectancy is high, infant mortality is low, obesity is extremely low, and preventable deaths are rarer than a lot of other countries.
Well, there you have it. I mean, think what you will, say what you will. Look at the statistics, right? Life expectancy, high. Infant mortality, low. Obesity, extremely low, right? Preventable deaths are rare, compared to a lot of countries. So, I mean, it's hard to argue with that, right? Experience from the average Aussie in the comments is usually, I'm pretty sure 9 out of 10 of them usually say that they're in favor of their healthcare. Like, they think it's good. So it's hard to ignore all those, right? One of the things I would be concerned about, but not really after hearing all this, is like the quality. While the quality seems like it's there, for sure, better than the US. So that means it's already an upgrade for what I'm used to. That's a relief. But also things like wait times and availability of either prescriptions or a specialist or something would be, come to mind for me. I've heard good stories and bad stories about our neighbors to the north here in the United States. Canada, of course, has a healthcare system more like Australia than ours. I'm sure there's differences. They have free healthcare, but of course it's funded by taxes and things like that. So it's not technically free, but it's definitely cheaper than the U.S. But I've heard, whether or not they're accurate or not, I have heard, bad stories about, oh, well, they had to wait to see so-and-so, or even for a regular check-in or walk-in appointment, they had to wait in excess of 10, 11 hours just to see somebody. So that's a concern, right? Whereas here, it may be very expensive, and I'm not saying the U.S. healthcare is better, because it's not. But at least some things like wait times usually walk in my experience, and get seen within an hour. It's very quick compared to what I've heard in cases. All of that is anecdotal. Of course, it can vary with everyone's experience. So this is very interesting. And you got to realize, as an American, of course, this is painful to watch. It's interesting and fun to learn. But of course, I knew going in that this, on paper and most likely in people's experiences, seems much better than the American healthcare. The American healthcare isn't bad by any means. It seems like decent quality care, but sure enough, it is not the best. And that's a shame, considering how expensive it is. How expensive it is, it should be the best, and it's not. So what a double-edged sword is that? It's not the best, and it's the most expensive. Kind of a shame.
And
America,
Australia does
come
it
on.
for a reasonably small amount of money. In summary, Australia has a pretty robust public healthcare system with a private overlay that half of people use for better access and services.
Yeah.
If that sounds familiar, it's because it's much like other systems we've talked about, including France.
There you go. Let me know your comments down below, where you're from and what the healthcare is like there. I'm sure I will have a lot of Australian viewers naturally, like I always do. Tell me your opinion on the healthcare. Is it as good as it sounds? If it is, be thankful. Proud of your country that it has that, and consider yourself lucky as well. And maybe if there is a problem with it, even though it might be really good, if there's something people don't think about, or something that is a little bit of a problem, point that out as well. If you don't like it at all for a certain reason, point that out as well. I'm a realist. Remember, guys, I'm very happy to be an American. It's where I grew up. It's my home still. And there's a lot of beautiful things about the USA, but healthcare, unfortunately, is one of our mess ups that we just have not got right. I will fully admit that. So that was very interesting to hear. Tell me your stories down below. Leave a like if you learned something, or just enjoyed watching that. Subscribe for more stuff like this. Check out the description for ways you can support my channel. And as well, this video will be linked there from Healthcare Triage. Check them out. My name is Ian. You're watching IWrocker. Until next time, guys, stay safe. Catch you later.